Okay, the Committee on Public Health and Human Services of the Worcester City Council is called to order on Monday, February 2nd, 2026 at 5:20 p.m. I'm Gary Rosen, at-large City Councilor and Chair of the committee. To my left is at-large City Councilor Kate Toomey, and we hope that the Vice Chair of this committee, Christian King, will arrive shortly, but we shall begin the agenda. With us is A.J. Pottle. He is our Assistant City Clerk, and he's clerking this meeting this evening. And A.J., do you have to do anything with 1A?
Thank you, Mr. Chairperson. I will. So 1A, pursuant to Chapter 20 of the Acts of 2021, and in order to ensure active public engagement, the City of Worcester currently allows for both in-person and remote participation at its meetings. To join the meeting, you can either come in person or join via Zoom. There is a link that's listed on the Granicus portal of the city's website, and there's also a phone number for tonight, which is 1-646-828-7666, and the access code is 161-014-0100. If you do wish to speak on a particular item, we do ask that you use the raise hand function, which is in either the bottom center of your screen, or if you're on a phone, you can dial *9. Thank you, Mr. Chair.
Thank you, and we do hope we have some folks at home or wherever they might be outside City Hall watching our meeting, and if they'd like to participate, we certainly welcome the public's participation on this committee. Number 2 on the agenda is the approval of the minutes, and these are the minutes of July 22nd, 2025. So the motion is to approve those minutes. All in favor?
Aye.
Aye. Opposed? So voted. Number 3, miscellaneous item, is the order of Council Etel Hajii requests the Standing Committee on Public Health and Human Services invite representatives from the Office of New Americans to discuss the work taking place to support refugees and new arrivals in the community. That order was back July 16th, 2024. So it's been a while, a year and a half, that order was filed and placed on this subcommittee's agenda. I'm going to take that with item 4A, which is transmitting informational communication relative to the Office of New Americans. And that report from the city manager came to the council and then sent to this committee on September 10th, 2024. So evidently those 2 orders about the Office of New Americans and the good work that they do has been on the agenda of this subcommittee for a year and a half or so. However, the Office of the New Americans, the folks were not able to attend this meeting this evening, so the motion on 3A and the motion on 4A would be to continue to hold to a future Public Health Committee meeting when these folks from the Office of New Americans can make it. So on that motion to hold both, all in favor?
Aye.
Aye. Opposed? So voted. So those will be held. Let's go to 4B, transmitting informational communication relative to the pros and cons of discontinuing the Central Massachusetts Regional Public Health Alliance. And that goes back to September 30th, 2025. So just a few months ago, this came to the City Council as a report from our city manager, and then it was sent to the Public Health and Human Services Committee, where it appears on tonight's agenda. And I believe that we have with us Tamara Lundy, the Director of Public Health. And Tamara, you're going to come up here and sit with us. And I know you have some information about this. And just to clarify for those who are at home, because I know sometimes at home it's hard to understand what we're talking about, so I want to be clear on each of these items. The city did end its relationship, discontinued that with the Central Mass Regional Public Health Alliance. And if I'm correct, I believe that that was an alliance among Worcester and Shrewsbury and Grafton and maybe West Boylston, just I think those four. And now that alliance has ended, and for, it sounds from the backup, for pretty good reasons. And, Worcester is still available to work with any and other towns that need our help and ask us for that. But, we're concentrating on, since we're the largest, one of the largest, public health departments and largest cities in, certainly in Massachusetts, we're concentrating on the issues particular to the residents and business owners and folks here in the city of Worcester, the students. And the other three towns, will be concentrating on maybe the issues that are more appropriate to their smaller towns and their maybe smaller public health departments. So that just sums it up a little bit. But Tamara, thank you for coming to our meeting. And do you have something to add about what's going on or why we ended our relationship with the Central Mass Regional Public Health Alliance?
Thank you to the chair. Yes, so it was a mutual decision to start a large cities contract with the state of Massachusetts, and the smaller towns, Shrewsbury, West Boylston, Grafton, also had an opportunity to take advantage of funding that was provided to smaller towns.
And that's funding they might not have applied for and received had they stayed as part of this alliance.
Correct, exactly. And the city of Worcester also had the opportunity to take advantage of new funding from the state, to continue to do that work. So the state was heading in a different direction for larger cities like City of Worcester. We were receiving the same types of funds that Boston and the City of Springfield also has access to. And then the smaller towns are through the shared services program, where they work together to meet their sort of smaller town needs.
So that worked out well for three towns in the city of Worcester.
Correct.
If my memory is correct, I actually thought we started this Regional Public Health Alliance because at that time the state might have encouraged that. And now it seems like they've changed direction and, financially we're, the four of us, all better off.
Correct.
Not working as an alliance, but still supporting each other when it's needed. Is that correct?
Correct. Yes.
Okay. All right. So it's something that was ended. It's unusual that you end alliances like this because usually in this day and age, they're encouraged either by the federal government or the state government locally. But in this case, I think it's worked out well for the others. Have you heard at all from the others how they're doing without the support of Worcester, the frequent support?
Through the chair, not a lot. They have, my understanding is they have hired and they are working along with the state to build up that office and support their towns.
Okay.
So it sounds like it's going okay.
And they're, working with Worcester in this alliance, there had only been 3 towns, which I know a while back surprised me that other towns weren't interested. I'm surprised because we have a very capable, professional, maybe not so much large, but capable, professional public health department. And I would have thought that the others would have said, oh, we can work with the city of Worcester. But it was those 3 towns. I know you weren't here when we set this up, so you might not have that knowledge. But I remember that saying to myself, gee, I'm surprised other towns didn't jump aboard and say, I want to work with Worcester. I don't know if you have any comment or any background on that at all, since you weren't here.
I don't, through the chair, no.
Okay. Okay, thank you. Councilor Toomey, any questions or comments?
Thank you, Mr. Chair. Thank you very much for being here and stepping in. And there's an interesting, my committee is Public Safety and Inspectional Services is under my committee. And so, I'm wondering, it says one of the most significant benefits of the transition has been the expansion of collaboration between DPH and Inspectional Services. And this report was done September 30th. We're now into February, and I'm wondering if we could get an update through you, Mr. Chair, through a chairman's order, as to the progress that we've made and what we're doing and what we still need to do to work more collaboratively together.
So Council Toomey's looking for an update on the relationship and partnership between the Department of Public Health and Worcester's Inspectional Services Department. Okay, Mr. Potter, you have that?
Thank you, Mr. Chairman. Yes, I do.
Okay, so on that chairman's order, all in favor?
Aye.
Aye, opposed, so voted. Any other questions? That's a good
No.
point, too. That's a good, I don't know if you're prepared to speak on it tonight. I mean, we can wait for a future report, too, whatever you prefer.
To the chair, so we have actually been able to have our environmental health coordinators who were in the towns, there were two of them, come back to partner directly with ISD and creating that liaison relationship. We have a full work plan that's a collaborative work plan between DPH and ISD that includes focusing on ensuring that our ISD team meets all of our FAB accreditation. We currently now have ISD coming to the Board of Health, reporting out on a quarterly basis. Our team and our data team has worked to create data dashboards for ISD to be able to track items like types of inspections, number of permits. And our team also is really working to help promote further upstream and proactive ways in which we can educate the community while ISD continues to provide the enforcement services that they do so well. We, in addition to that, have been doing a lot of research around body works and body arts regulations, and so our team really has taken a strong sort of supportive role in being able to dive deep into some of these regulations, as well as looking at what some of the best practices are across the country to help us move forward and just enhancing the standards that we're working to meet at an accreditation level.
Did the Commonwealth of Massachusetts have anything to do with encouraging the city to take those two departments, Public Health and Inspectional Services, and have them partner and work together? I thought that might have been through something through the state, or was that just through the city of Worcester, our own folks?
To the chair, because of our FAB, our Public Health Accreditation Board, it includes the work and operations of ISD as well as DPH. It really benefited for us to work together,
I see.
and we've been making those efforts.
I see, good. And as Councilor Toomey knows, I just finished 4 years on the Board of Health, and I had the pleasure the past and last year on the Board of Health working with Tamara Lundy, and do a great job. You've been, a great asset to the department and to the city of Worcester, so we appreciate that. And, the entire Public Health Department just does so well, and I would guess we're still understaffed. I mean, we get accredited and we get a lot of praise, which just, shows the leadership folks down there and the folks who work on a daily basis in public health are just doing a wonderful job. So we thank you for that, and please realize it's noticed too, and appreciated.
Thank you.
Okay, you're welcome. Okay, so on, on 4B, the motion will be to file. All in favor? Aye, opposed, so voted. Thank you, Tamara. I don't know if you're going to stay for D. Are you going to stay for D or not? I don't know if that's, you don't have to. We've got, we've got Casey here for that one. So, okay, thank you. Let's go to 4C, which is transmitting informational communication relative to use of emergency warming and cooling centers for the last 2 years. And we have Charles Goodwin. He's the Emergency Communication and Emergency Management Commissioner. Nice to meet
Thank
you. I don't
you.
think I've met you before.
We have not met yet, except in passing at a council meeting, so it's a pleasure to
okay.
meet you.
My pleasure, too. You probably know Councilor Toomey.
Yes, it's also under my committee.
Absolutely.
All right, well, we're glad to have you here. And the cooling centers, I was up at the I won't say cooling, I guess, the warming center Friday at the Worcester Senior Center, which, like in the spring and summer, it's always so hot there. Well, it had been for years. I guess they got a whole new air conditioning system the last few years, but we used to run bingo there, and it was always so hot in the summer and even in the spring. But I was surprised. I was in the cafeteria area Friday. Weren't many people up there. And it was really cold, and I just thought it was a little too cold for a warming center. So how are they going? How is it
Yeah,
working?
generally speaking, so this was at a request of a council order for the usage of emergency warming and cooling centers for the previous 2 years. But as I indicated in the report, when we open emergency warming and cooling centers during the day, we don't actually track how many people are there because they're often open public buildings already. And they don't offer any specific type of service, except during the summer, we do provide cases of water to any emergency cooling centers, so that way anybody that comes in has access to water so they can stay hydrated. However, you know, as indicated in the report, we've opened them quite a bit. As
Yeah.
you can tell outside, the weather is not always the best for, you know, being out in those, in the climate. But it's something that we've had to do many times and will be continuing to do many times. We just did one just during the snow. It was an emergency overflow shelter, and then during the day, we opened the building as a warming center for anybody that needed to go in as well. And we're working on continuing to do that on some of the future cold that's coming as well. But this operation generally works very well with the city. We have usually the library as well as the senior center, depending on the need at the time and the availability of the buildings. But we open them during normal business hours. They remain staffed by the normal staff that are there. From time to time, we do have to bring in facilities or a couple of volunteers to help just hand water out or hand items out when we need to. But otherwise, we've activated them quite a bit, and I think they've been a good use by the city and by the residents in the city. But it is hard to tell how many actually go in. A lot of times, I've found that the public library downtown is more utilized than the senior center.
Right.
But we do try to open more than one when possible at different areas of the city, just to allow for access for people in those different districts. And we try to make sure that we open them on bus lines, so they have access if there's only one open, or if there's only two open and you're in another area of the city, that we make sure they're at least open near some sort of a bus line so that you have access to get there if needed.
I see. So they could still go to the library or the senior center, even if the city didn't designate it as a warming center or a cooling center, they could still go there.
Correct. Generally speaking, the only time that changes is on occasion over the weekend. If we use the senior center, we'll work with facilities to open it up as a warming or cooling center on a Saturday or Sunday when they're generally closed. But otherwise, it's usually during normal operating hours of those buildings.
And I would assume you get more people using the library because on a normal day, more people go to the library, and more people from youth to senior citizens are used to the library. They've gone down there for years. And unfortunately, even though I've qualified to be a member of the Worcester Senior Center for a couple of decades now, unfortunately, some people, when they hear Worcester Senior Center, wish we could change the name, Worcester Senior. Some people say to me, "You go there?" And oh boy, then we have that discussion, and it's just sad what some people think. It's part of the whole ageism process that people into and so on. But it's a great place, and it's a great place to have a cooling center and a warming center, as is the library. And recently you had the Worcester Technical High School. That must have worked out well, and you chose that because, I'm guessing, because maybe the food service, is that?
So it was open, we were originally going to open a separate warming center, but chose, since we were already utilizing the facility and had access to volunteers and were utilizing it as an overflow shelter, it made most sense that we worked with DPW to keep the plowing going up there, and that we utilized that space since it had backup generation power, a good heating system in the gym. We were ready to go, and it worked out well there, yeah.
I see. Very good, okay. Well, good job. I know it's been working out well, and I've heard from people from both the library and the senior center that they've been very pleased going up there. With seniors, of course, if it's so cold out and they would like a warming center, they're still reluctant to go out because they're saying it's too cold to go out even to the warming center. So as long as they have the heat at home, they tend to stay home. And it's like that during, a snowstorm. Even sometimes during heavy rain, they just are, reluctant to maybe venture out on days like that. But at least we have the facilities available, it certainly is appreciated by folks in the city of Worcester, even
Yeah.
ones who don't tend to use it, but they know that their neighbors can use it, and so on.
Yeah, and it's understood, and I think oftentimes, we in my office work closely with National Grid and Eversource, so we track if there's, the potential for an outage or electrical outage during a snowstorm, and then we can work with some of these facilities to ramp up access to them if it's needed, if we have an outage of some sort in the city, because certainly the last thing you want to do is stay home with the power outage and not knowing how long the power's going to be out.
Definitely.
You can usually stay at home for a little bit, but then after a while, it's going to be time to warm up, and that's what these are for.
And you and your staff work on these heating and cooling centers, but you don't work on the emergency shelter for the homeless.
Correct, yeah. So we do emergencies after disasters or emergency weather type events. So we do warming and cooling centers during the day. But the shelters for the unhoused population, that's generally a Health and Human Services function. We do support them through some of our grant funding. We're able to try to provide blankets and cots and things like that so they can open them. But generally, we hold off and we utilize most of our operations on emergency shelters after disasters. So if there was, during that snowstorm, for example, if there was a large-scale power outage or roof collapse or a large fire, then we would open another shelter, and that's where emergency management thrives, is getting to get to the people, get them out of, whatever disaster they've been in, and then start working with the American Red Cross and Salvation Army to provide them support at that shelter.
That's good work. Any questions, Councilor Toomey, or
He's
comments?
doing
No?
a great job. I do want to just say, though, that if anyone is interested in working with the St. John's Food for the Poor, if they go to their Facebook page, there's all sorts of ways to sign up, and we appreciate everybody working together. So,
Absolutely. It's a collaborative effort,
Yeah.
between a lot of the departments and St. John's and their nonprofit staff and some of our, nonprofit partners in the city to make a lot of this stuff happen.
Yep. Thank you.
Thank you. And we are glad now to be joined by at-large City Councilor and Vice Chair of the Worcester City Council, Christian King.
Thank you, Chairman Rosen. My apologies for being late. We're having a flooding event at my home, so I'm working on about 2 hours sleep. So got up here as soon as we could. I had a couple of questions through the chair regarding the cooling centers. Just kind of taking a look at this data that was provided. The variance in the number of instances per calendar year within which this service was provided was striking to me. When you take a look at 2023, 2024, and 2025, it looks like in 2024, we were at 11 instances where there was activations, or 11 activations, 4 in 2023, 4 in 2025, in 2025, 2 for warming, 2 for cooling. I didn't notice any other warming activations other than in 2025. So I just wonder if you could speak to that variance. And I have a follow-up question to that I'll ask once you speak to that.
Certainly. So through the chair, we activate warming centers and cooling centers based off of specific criteria during the day. So warming centers, or cooling centers are open anytime that the ambient temperature or the heat index reaches 95 degrees or higher. I believe there were many more warming and cooling centers before this, but at the time that the report had only asked from July to
Okay.
June of 2025.
Fair enough.
So there were some in both years. It's certainly some later 2025, but it seems that it's been a lot hotter during the summers lately than previous years. And then the warming centers are a lot based on cold weather advisories and extreme cold warnings, as well as frostbite risk that we base it on. So during the day, You know, we did do it for the weekend during the snow event because we did reach those cold weather advisory risks. And we're looking at the weather coming up for this next weekend for the same thing. The expectation that during the day there's going to be a very low wind chill that'll require us to open them as well.
Thank you. And I apologize again. I'm operating on very little sleep, so the term escapes me. But relative to the fact that when I was driving, I heard you say a little bit about not tracking usage, no specific metrics, et cetera. And the term that's escaping me is, we had this in my committee last year, the areas of the city where we have less tree canopy, areas of the city where we have higher rates of asthma. I don't remember if it's heat islands, heat deserts, whichever the term is. But there's an additional term that I'm looking for. I can't find it. But my question is, it seems to me that tracking data relative to the locations that we're using, South High, Worcester 311, which is far away. I don't know if it's even near any sort of, population or demographic that is most needy. But public library, et cetera. I'm just wondering what the thought is around gathering data for the purpose of making sure we're servicing those demographics with intentionality, with location, and with communication to see, how effective that we can be through the chair.
Through the chair to the counselor, we actually did do this in 2024. We worked with the College of the Holy Cross, and we mapped out our tree canopy cover and our areas that there's low tree canopy cover, which would increase the amount of heat because of
What's the term
pavement.
again? Because that was in my committee last year. I can't remember the term.
And it's escaping me right now too, but I know exactly what you're talking
Yes.
about, and it's the measurement of the amount of a pavement out there that sucks in the heat and then pushes the heat back up, or actually almost reflects it back up, causing it to be a hotter area. And a lot of that is downtown, or down in the area of the main public library, as well as
Brompton Park.
we've used for 311. It's not the call center, but the location on Main Street.
Okay.
So 799 Main Street, we open as a cooling center a lot to hand water out, because that's another area that it's a significant amount of low tree canopy cover and higher heat indexes. So we have mapped that out, and we generally try to target areas that we have public buildings to open for cooling centers. We have opened a couple of the other library branches in the past as well, when we've seen that the heat index in those areas is a bit higher than the rest of the city. So we do try to track a lot of that across the city, and we have a number of different weather stations that we have access to across the city that we monitor all of that data, so we can see how the weather conditions change based off of the different locations in the city. Because as you can imagine, it's always a little bit cooler up by the airport, being 1,000 feet higher than the rest of the cityscape. So we've got weather monitors across the city that we work with our meteorologists and monitor those consistently.
Okay. And so we have no idea of any data relative to these dates, or how many folks are accessing them. There's nothing.
Through the chair to the counselor, no, we don't track them because they're all open at public buildings that are open for business already. So as people go into the library, the senior center, or another location we open, we don't ask them if they're there just to cool off because it's hot out, or if they're there for other business. It's a public building and we allow them in. We just make water accessible to them, and whether they're utilizing it as a cooling center or they're, a library patron that just also wants to have water, we don't distinguish that. We just hand it out to whoever feels that they need it.
Okay. I do think, Mr. Chairman, that there might be a way that we can continue to not just grow, but evaluate how this service is being provided and how it's being accessed. And while I understand if you're at the public library, you may be there for using the public library or using the services at the senior center, perhaps at South High as well. But it seems to me that it might make sense at some point for us to get some data so we can measure access and perhaps if there's any sort of educational piece that could go along with that in those locations. You probably already do it, would be helpful. We know that folks need to cool off, and we've lost our public pools. We have folks that are housebound who aren't able to get around. We have folks children and youth whose parents are working 3 and 4 jobs, and they need a place to go. We have one city pool, one. They were taken away many years ago by a city council that paved them over and gave us spray parks, or cemented over some of them. And what you see there is limiting the demographics that access it. Because if Gary Rosen shows up in the middle of the summer by himself at the local spray park, I might be making a call as I'm watching my daughter play, if you understand what I'm saying, Counselor. I just think that if there's a way we can use data to get us access to other things for folks in the community, maybe measuring this is that way. But I'll look forward to maybe in the future hearing a little bit more about that, Mr. Chairman. Thank you.
Thank you, Councilor King. Councilor Toomey.
Thank you, Mr. Chair. If I recall, remember talking about the heat islands and cooling deserts previously. And I recall filing at least once, if not a couple of times, an inquiry into possibly using misting stations, especially in those areas that geographically may not have been adequate serviced by these places. And did we do anything with that, or is that something we could do, or?
Through the chair to the councilor, we actually tested our first misting station towards the end of the summer. It was purchased with emergency management grant funds that we got from FEMA. We tested it out, I believe, behind City Hall during some of those Lunch on the Common events.
Okay.
And it was very positively received, so we plan on working on securing a few more of them and utilizing them throughout the summer, this summer. And we do have some partnerships with like Open Sky to utilize them near their facilities and hook them up to their water. And
Great.
so that's something that we tested, and it did work well.
See, I'm good for something, right? Oh, that's great to hear. I'm glad to hear that, because it just seemed like it made so much sense, and it was a low-cost endeavor.
Yeah, absolutely.
Thank you.
And it's something that I think in areas like behind City Hall on a Lunch on the Common Day is perfect, because people can walk through it. They have, I believe, 6 or 8 gallon tanks, and they run on a small generator that's not too loud, and it can run all day with a large fan, and they're all very portable.
Great. Thank you.
Thank you, Councilor Toomey. So on 4C, transmitting informational communication relative to use of emergency warming and cooling centers for the last 2 years. That was originally brought forward in July 15th of 2025. And the motion on that would be to file. All those in favor? Opposed? So voted. Thank you, Mr. Goodwin. Thank you for all that you do here in the city of Worcester.
Thank you.
And 4D, the last item on today's agenda of the Public Health and Human Services Committee, is transmitting informational communication relative to a Worcester Community Food Assessment Report that originally came in front of the City Council in August, the report from the manager, August 27, 2024. And we have with us Casey Burns from the Center on Food Equity. Tamara, are you here on this one too? If you are, I don't know if you are, you can come right up too, if you are.
Whatever works.
Yeah.
I have the copies of the full report.
Oh, okay, wow, this is pretty good here.
Is that, oh, yeah, that's the slides.
Yeah, the slides, right. So what's going on with our community and our food and some of the food inequities we hear about, especially during the winter months?
Yeah, absolutely, a lot. So, yeah, just for a quick recap, so we did this community food assessment. Okay, cool. Hi. Yeah, thanks. Good to see everyone. Casey Burns. And so we completed this. This was Worcester's first community food assessment, but it's a model of doing assessments that has happened around the country for probably the last 20 years or so. And there's a John Hopkins Institute runs a lot of best practices on how to do these community food assessments. So we looked to some of those bodies in order to, kind of build this methodology that we used for this one. But this was completed in July of 2024. And it was part of a response of kind of a reformulation of kind of the food coalitions that do work in Worcester. Worcester has one of the oldest food policy councils, oldest and longest running food policy councils. It was established in 2006. And then we established the Central Mass SNAP Coalition to work closely with the Department of Transitional Assistance in maybe 2012 or 2013. And then during COVID, out of a Worcester Together group, we developed the Task Force on Food Security to kind of manage more programmatic aspects that needed. Policy Council was doing more, local, state, federal policy issues related to food. SNAP Coalition was working closely with the DTA on communication and all of that work. But then during COVID, we especially needed to coordinate, food pantries who needed to deliver. We started the Hot Meals program, delivered about 30,000 meals to COVID positive, food insecure households. And so we started the Task Force on Food Security and then really found that those three bodies worked really well in synergy with each other. We were able to have program-informed policy, policy-informed program, and just work together really nicely. We also established out of that effort, we established a new website called foodhelpworcester.org around COVID resources. We wanted one place to find information on Meals on Wheels and farmers markets and SNAP application and retailers and all of those things, food pantries all in one place. So we established that website and then just really saw that we had a lot of momentum going between these different initiatives. And so we went to the Worcester County Food Bank and asked, would they be willing to kind of support these as an umbrella entity? And we rebranded it the Center on Food Equity, that then had these three coalitions under it that continue to work closely together. And I co-chair this group with Gina Platanino, who wasn't able to be here today, but she also works on national advocacy through the Food Research Action Center. And so in doing this new entity, we knew that places around the country do these food assessments. We had a lot of more attention on food issues than we had before. We had funders and folks coming to us, how should we spend these dollars to be most impactful? What data is available to guide this or this initiative? And so we decided, let's practice what we preach, and make sure we're giving recommendations based on data, based on real community feedback. So we decided to do a community food assessment in order to ground us in what our priorities would be and really what our understanding of the issues were. And so we looked to kind of three primary data sources and that we already had a foundation of really good data from: the community food assessment, a study that was done in collaboration with Tufts University called the Catalyzing Community Study, which did these kind of they call them causal loop diagrams, where the community members talk about how, medical bills and access to education and housing is related to food security and how people make decisions based on these different factors in their lives, and they drew that out. And then the Research Bureau study, which did a really good study on particularly looking at SNAP access and the SNAP gap, the percentage, the kind of difference between who is eligible for SNAP and who is currently enrolled. And they saw that in some neighborhoods in Worcester, it was there was almost a 70% gap of people who were not participating in the program. In Worcester County, about 40% in SNAP. Yeah, and so
Why is that? They didn't know about it? They're just not educated enough about it?
I think a lot of different reasons. There's kind of fear of public charge around, what's going to come back to you, giving your information to the federal government. There's stigma around, no, that's not for me, that's for, these other kind of people. There's kind of misinformation around how much money you actually get and the burden of what it takes to apply for it. And then there's just kind of people being daunted by the paperwork and applying and all of those things. I think it's a combination of lots of different factors that we try to mitigate through, some of the initiatives that we do, getting out correct information, offering support to applications, all those things, because it really is, such a powerful program.
Do you think, Casey, that a lot of folks who aren't taking advantage of the SNAP program are on Medicaid, and maybe there's some way, because they really have to be on Medicaid pretty much, I mean, you have to have health care.
Yep.
So I wonder if there's some way we could kind of connect the two. So as I'm doing my Medicaid work and paperwork and going to interviews and whatever that involves, maybe there could be some, oh, by the way, you qualify for SNAP. Are you familiar with that?
Yeah.
Is that possible?
There is a new common application, newish common application that I'm in the state of Massachusetts, and so that does connect. But what it does is it flags your application as you apply for health insurance to a SNAP outreach partner like Worcester Community Action Council, which will then contact you in order to follow up on that process. So they are trying, and that has been a real breakthrough in applications. But still, there's significant portions of the population who don't utilize the resource for a number of different reasons.
Maybe it was easier years ago when we called it food stamps.
Yeah,
instead of
sometimes-
SNAP.
yeah, sometimes
'Cause most
it's just-
people don't know what the SNAP stands for. I
Yeah.
forget it all the time, too.
Yeah,
So-
Supplemental Nutrition Assistance Program,
Right.
absolutely, yeah. So yeah, a lot of different things, but this Research Bureau study, it shows, kind of food insecurity rates around Worcester, and then here's where it gets into, dialing into those SNAP gap numbers too. But those were really just like the three pieces of foundational research we used before we did our study, because we don't want to start from scratch, reinvent the wheel. This research has already been done. What do we know coming into this? And then what don't we know? And so what we really wanted to focus on, because food assessments can focus on all different kinds of things, production, distribution, and trucking, and farming, are all different, type parts of the food system. But in looking at Worcester specifically as an urban center with the kind of concerns we had from the foundational research, our major questions were, if we have these resources, because there's been, I always say, every semester, I think I get approached by some student group who wants to map all of the farmers markets in Worcester, map all of the SNAP retailers, and these are like great projects, but I'm like, this has been done, and we actually have sometimes a tremendous amount of resources in some neighborhoods. But then we'll get folks to saying, well, my food pantry is totally overwhelmed, and then another place will say, do we even need the food pantries anymore? Nobody comes. And we're like, all right, what's happening that we're not communicating and coordinating? And so that was really kind of the driving questions. We have 7 questions here, was really like, what is the experience of people facing food insecurity? What are the decisions, what resources are actually helpful for them, and why do they or don't they take advantage of some of these resources? So that was the question we really sought out to explore. And in doing that, so in order to find that out, we went through a number of different things. We did a survey, and excuse me, and we partnered closely with the Worcester Division of Public Health as well as UMass Prevention Research Center in designing that. We did community conversations and focus groups in Spanish and English. We looked at mutual aid Facebook posts, and we looked at not only what questions were people asking, does anyone know if there's a food pantry open in my neighborhood, but we also looked at the responses. And if there are 25 responses, what percentage of those was accurate information? What percentage of those were people finding the information that they needed? And that was a helpful way to look at it. We sent volunteers out to food sites, to summer meal sites, to food pantries, to SNAP application support. We called the hotlines. We did all these things to test out, what is it like, not as secret shoppers, because we're not trying to spy on anyone, but to really test out, what does this line look like? What does the flow of these look like? And then we did a survey with staff at food pantries as well in order to get their insights. So we looked at all those different pieces, we designed methodology across all of those things, and then we pulled together the data. And so there's a lot here I won't go through with the findings, and we have responses and kind of talking through what, kind of the major telling points around food insecurity were. We have additional information, and we have a whole appendix of exactly who we talked to and the data around that. But we, kind of looked at the fact that many people who About 56% of our survey respondents indicated that they were food insecure. Food insecurity with children, households with children were more likely to be food insecure than those not, especially true for those quoted Hispanic households. And then we also found that the majority of survey respondents reported not being screened for food security by their healthcare provider. And of those who were screened, about 58% screened positively reported that they weren't referred to any resource. And so that was a significant gap that we've been really trying to work on to follow up. And there's been changes in social determinant health screenings in healthcare settings like UMass Memorial, and they've been making updates to that. But we've been working closely with them to make sure that they have the processes and connections to community to be able to refer people where they need to be. Just some interesting couple other highlights. One of the things I always like to point out is like cooking from home, I think was a really interesting finding, because the majority of our survey response reported that they did not face challenges when cooking from home, and those who did, the primary barrier was lack of time. And I just point that out because a lot of times in food work, I find people jump to a lot of assumptions and conclusions about what people need. And we'll see people, out of the goodness of their hearts very often, but kind of make assumptions of, oh, maybe we need to run cooking classes. Maybe we need to provide recipe cards, and they just don't know how to use it. What people told us was, I know how to cook. I come from a long line of culinary tradition. I just don't have the time to do that. And I don't have the time to go to one more place to shop. I don't have the time to all those. And so this is not to say that not anyone needs support from cooking and cooking from home, but that it's really important for us to be accountable to the data of what this is telling us, and to make sure that our solutions and resources are really catered and responsive to what people are saying that they need, because it can be more complicated. Another story I always tell is, I've been involved in many initiative where, we're going to put kale in the local corner store or something like that, and then what people tell us is, I don't shop at my local corner store for my vegetables. I take a cab to BJ's once a month, or whatever it may be, and I do bulk shopping, and then I might go for like small things. And so, but it's like kind of those assumptions, oh, people don't have transportation, and so we need to put this vegetable in this corner store. And so it's just a lot of those things that just relate to me around like community accountability to what people are saying they need, and really designing those with community members in mind. So I'm gonna skip ahead because, another highlight just in saying that is, I think one other thing in the summer meals program, just because also this, I think, relates to partnership with the city of Worcester.
Mr. Chairman, I missed,
Sorry.
you rambled through the name. I didn't hear what you said. The what?
Oh, the summer meals programs.
Okay, thank
yeah.
you.
Or
I couldn't understand.
Summer Eats, I guess it's called
Okay.
now. And so this is the free summer meals programs provided by USDA that's, through Worcester Public Schools and Friendly House, distributed at number of locations across Worcester, Recreation Worcester sites, public parks, lots of different community spots. But one of the major challenges that we heard in that program, and we were ready to hear, kids don't like the food or this or that, but what we heard mostly was that people couldn't find the sites. They didn't know where they were. There wasn't a reliable map located. They went to sites as they were listed, and they couldn't find them. And then we sent community researchers out to go and do these observations, and about 50% of the time, they couldn't find the sites. And so this was like a major, I mean, it was almost relieving, because I'm like, that we could address, potentially.
Where were
food
these sites
part.
that were so hidden? Where were they?
Like even like at East Park, they'd be in the back of the park rather than right in the front. And some of the sites, there's into the weeds, but some of the summer meal sites can either be run as open sites or closed sites. Closed sites will be like as a camp program for participants, so you can get meals to serve to your youth program, but they'll list them as open sites because in theory, they're like, sure, anyone wants to join us for lunch, but then it'll be behind a locked door, or behind a gate at a complex that you can't get into. And so people aren't actually able to, but then for that parent who's just trying to find a meal for their kid for the summer, that's a really frustrating experience that could potentially, put them off to participating or, going back to try to find another site. So with that in mind, I will just skip ahead to look at, kind of this recommendations page. because what we did was, we went through the findings, we went through all of these federal, state, and local programs that are run, and and you can peruse more on the details of kind of the highlights of what was found in each one. But what we looked at was that we really could kind of consolidate the recommendations into 5 major areas. And those were centering lived experience and advocacy. And that was around some of these assumptions that were made and like policy, that understanding kind of the nuances of how programs work, how people were making decisions, what they were weighing when they were thinking about what resources to utilize, really took like a deep understanding of that navigation. And so that we were often missing in doing some of the advocacy we were doing. And so we really needed folks who understood the programs by living through them to be centered in the way, what we promote. And so that was part of the strengthening that we've tried to lean into across our coalitions, to really think about, okay, so we need our program partners who are really working with people and community members to inform then what our policy agenda is going to be for the Food Policy Council. We looked closely at the SNAP program, and we have specific recommendations around, so for the advocacy, we've been leaning into running advocacy training programs and cohorts, making sure that when we're promoting testimony at state hearings, different things, we're uplifting people. We're doing storytelling project where we're collecting stories that we'll have a release for on April 7th. That we've been collecting stories on specific topical areas in order to kind of showcase the complexity of people's lives and work and their interaction with the systems and how they're making decisions, and use that to then lead to our advocacy agendas. So that's some of the work we've been doing on that. On SNAP, we really need to look at, what were the barriers in working on SNAP? How do we support better referrals with our SNAP outreach partners, like Worcester Community Action Council is an enrolled partner? How do we work more closely with healthcare? So we're making those social determinant referrals when people are being screened at their healthcare offices. How do we support also referrals at Worcester Public Schools, nonprofits, so we can kind of facilitate a no wrong door approach? And then how do we also just advocate in order, which is a tough environment to do right now because we're just trying to maintain the bottom line with some of the federal changes and impacts on SNAP and changes to the state, but really looking at how do we support strengthening of the program wherever we can, and thinking about the calculation of how the dollar value that people are assigned, it's used by a calculation called the Thrifty Food Plan, and how that, calculates how much people should need to afford healthy, balanced meals for their families, and really just working on being accountable to all of those things. The next area, the third area, was around communication. So like I said, that was a major challenge around a lot of the programs, is that we saw that information wasn't consistently available and accessible. So this is why we decided to develop and really invest in our Food Help Worcester website, really looking at communication around summer meals programs, around, how resources are advertised around SNAP. Currently the DTA has, I think, 70% of all calls that go into the DTA are dropped because you're just not going to get to a live person before they close for the day. So you don't even get this, we're experiencing high call volume, your wait will be an hour. You're not going to get to anyone today, and it just hangs up. That is compounded by the fact that the DTA moved from downtown in Worcester out to Route 20. And so it's a significant challenge, and we actually had people ride the bus from a number of different locations around the city, and it was about a 4-hour round trip visit to go there and back, including walking on some, unpaved sidewalks. So really significant challenge to be able to do that. And so I'm bleeding into communication a little bit, but making sure that we have the information to people. There's other ways they're trying to facilitate, putting kiosks up at other places so they can access that, promoting the app and the website, but we know that doesn't work for everyone. Is accessible to some older adults, some other folks who aren't able to access in that way, but really just trying to facilitate and support information, as well as continue our advocacy. We're promoting a statewide policy called Act to Protect the Safety Net, which would require DTAs around the state to engage in a community engaged process before closing or relocating an office, to report on the accountability of how that would affect their public charge to provide meaningful access to a physical office. yeah, it's a complicated brew as the DTA is under so much pressure and so understaffed. And so we're also pushing for statewide support and through the governor's office and the governor's anti-hunger task force as well in order to increase funding for DTA case managers, because we know that is a really meaningful part of this. The next one was transportation. And so transportation, we looked at, and the CMRPC has been a really great partner with us on this, who's been mapping bus routes to grocery stores and other food access points, and like really mapping out and calculating how long it takes people there. You know, we get a lot of complaints about how long it takes to get to Market Basket or other places sometimes. We've also been looking at the RTA's seat policy, which currently is, you know, you're not technically allowed to take up more than one seat on the bus, but that makes shopping for a family with multiple grocery bags difficult. And so I think a lot of times people will take the risk and get on, and the bus drivers, if the bus isn't full, will look the other way and, you know, allow them to, but they are taking the risk that they can be told not that they're not able to get on the bus with, yeah, multiple bags. Yeah, so that's been a challenge that we've been trying to think through, and there are solutions that some communities will do with, you know, a special storage area they're able to put things, or they're able to, or there's special shoppers routes that, you know, forgive these rules for a time being as well. But we also heard from a lot of community members that they will sometimes take the bus to the store and then a cab back because they don't, you know, they want to be able to have a secure way to bring all their groceries home. And then we're also looking at policies such as, or like investments such as, you know, connectivity of sidewalks and other things, so that you have like door-to-door access if people are taking the bus and then taking a cart or something, you can get all the way, and the, you know, sidewalk conditions to be able to get to people where people need. And then the last one, and we intentionally put this last, was on kind of like program services, because we know a lot of people will jump to, and they are very critically important aspects of our food system, but we'll jump to kind of, let's start a new food pantry, or let's, you know, do all these things. But what people told us in this foundational research is that these systems and the complexity of systems were really driving, you know, with transportation, with access to information, with their housing choices, all these things were really driving aspects of food insecurity more than just kind of like point-to-point access that sometimes we think of, like proximity of where the resources are close to you. And so a lot of times people will jump to things like food pantries, critically important, but we know that, you know, Project Bread always gives a statistic: for every one meal in Massachusetts that is given at a food pantry, SNAP provides 7. And so we cannot food bank our way out of the SNAP crisis and cuts to these kinds of state and federal programs. And so we really need to make sure that while we invest in food pantries and support the work that's happening on the ground with food, you know, meals programs and all that, we are also investing in the advocacy it needs, that we're not going to be able to fill that critical gap in resources that people need. And so we support and work very closely with our network of food pantries, trying to promote choice models and dignified ways for people to be waiting in lines when there are, especially in the cold and other kind of harsh conditions. But we also want, at the same time, not either or, but at the same time, to make sure we're like really looking at those drivers. And so, for quick updates on this last page, I just listed some of the things that we've been working on as part of the Center on Food Equity since this came out, which, you know, since it's come out about 1.5 years ago or something, if I can do math. But we're working on a number of things that have like come out of this work. And so there's a grocery store access working group that has been working on that as we look at kind of retail access as an important part of people's kind of shopping patterns and access to food. And so we've been looking at, we did a series of, working closely with Division of Public Health, we did a series of community conversations as well as a survey to really understand how the Stop and Shop and the Stop and Shop on Lincoln Street and the Price Chopper and Webster Square area closures have impacted those communities, and how people's shopping patterns may have shifted or any hardships people have experienced. And then we've been looking at different models of grocery stores, because we know we heard, like when the Stop and Shop closed, that one of the things that whoever it was the manager spoke to had shared things like, well, this isn't even specific to this area. This is just a model that is a really tough industry. The margins are so tight on grocery stores. People are moving to online, all of these things. How do we make these models work? Because we know people need groceries. And so we've been looking at, are there other alternative models that are working, that are viable in their business models, looking at, nonprofit grocery stores, like there was the Daily Table, which was started by the Trader Joe's founder as kind of a mission-driven nonprofit grocery store model. We've been looking at the municipal model, like they're looking at New York City with Mondani, looking at cooperatives, regional, local chains, traditional grocery stores. We have a couple of interesting leads we've been working closely with economic development on in order to think about that. And then I'm hoping to be able to kind of collaborate with some of the partners like Worcester Housing Authority and others in order to hopefully bring one of these resources to Worcester. Another, in one of the key areas. Another thing we've been working on is the gift card distribution. We've been partnering with United Way, City of Worcester, UMass Memorial, Worcester Public Schools, Worcester Housing, WCAC, and others, and distributing $100 gift cards that was raised through the United Way through the SNAP crisis, when SNAP benefits were delayed in early October with the government shutdown. Delivered about 1,300 gift cards through Worcester Public Schools so far, as well as almost another 1,000 through Worcester Housing Authority, and then an additional 1,000 through Worcester Community Action Council. We have been looking at food pantry delivery models, because we know due to transportation and other things that there's no centralized, currently coordinated system between food pantries. And we rely on volunteers and other things, but there are initiatives, like there's a program through DoorDash called Project Dash, and they're offering some incentives for the first couple thousand deliveries for free. So we're looking if we have the stock of food in order to be able to provide those deliveries through the food bank, but we're working with them on that. Like I said, we're working on the storytelling, the digital storytelling archive, and hope to have a launch, in-person launch for that on April 7th. And then we're doing our advocacy training, looking at how do we support more advocates working on these issues with those with like personal in-depth knowledge of this. We're maintaining our website. And then we're continuing to do state and federal advocacy, looking at mitigating harm from HR 1, with the real SNAP changes and changes we know that are going to come with additional administrative burden costs from the state of Massachusetts, which we haven't had before, which is going to be a significant budget number to make up. But we're looking at, with all the changes in work requirements, in a lot of changes around different immigrant refugee populations who are losing SNAP benefits, looking as much as possible where we can communicate people's rights and access to resources, connect them to other resources, and look at ways that we can, kind of continue advocacy to hopefully try to stop the bleed. To end there.
Good job.
Thanks.
Wow, I had a lot of questions, but you kept answering them.
All right, good.
Going along, but you're going to get a lot of questions, I have a feeling, so, nice, brief, concise answers.
Okay.
Just some odds and ends here. So people in Worcester, we know it's so difficult for many of them to pay the high rents. That must affect food insecurity too, just something like that. It affects
Absolutely.
them in so many ways, but you see that, I'm sure.
Absolutely, housing is one of the greatest drivers that we see, and that was in those early causal loop diagrams. That was one of the the three centered things that we found were time, access to money, and unfettered access to federal benefit programs, but really like all impacted by cost of housing.
Right, that's a huge issue. And then at least, I didn't know, as I said, about the RTA not allowing people to take up a seat with their bags. I mean, never heard that, but at least we have the free busing. That's worked out well, I guess.
Absolutely, yeah.
So that's been good. I guess the system is not possibly obsolete any longer, Counselor King. Never was. I said possibly. And I've been thinking a lot about food pantries, and it seemed, and you talked about delivery too, which is a unique service too, if we could do that. But you seem to think that the importance, I was getting the idea that food pantries aren't as important as I personally thought they were.
I think they absolutely are important, but they are not going to solve food insecurity. I think they're meant to, take people through, but they are not going to address those root causes, and they are not going to provide kind of the stability and resources that something like state, federal benefit programs can.
About how many do we have food pantries in Worcester? Any idea?
Part of the Worcester County Food Bank Network, I believe there's 26, but then I think there's another 12 or 15 that are out of the Food Bank Network. Don't quote me exactly, but it's something like that.
Well, that's a lot. Oh, you have a list. Ooh, that was,
For
yeah.
Worcester and Worcester County, but I want to verify, then have my interns.
Oh, yeah, absolutely.
Verify and make sure.
Yeah.
Yep.
Because I don't know where they are, but I know I had read over the last several years, just Worcester State University, so many of the students,
Yep.
which happens to be my neighborhood, so I'm always concerned with it. And I was the District 5 council at the time, too. So many students have food insecurity, and would they know where maybe food banks would be? I mean, if I don't know, would they know? Hopefully they would, but
Worcester
is that-
State has a pretty good, what are they called? The Hunger Campus team? I can't remember. But they have a pretty
they
good
do.
team and coordination there. I was working with them a little bit. They were exploring a SNAP grocery store on campus. But yeah, absolutely. I mean, the access to information is always a challenge. Worcester State and Quinsig are also part of the Hunger Free Campus Initiative, which provides some resources to public universities, colleges and universities in the state. But yeah, there is hunger present on all Worcester college
if someone
campuses.
asked you, Casey, if in that broad Worcester State area, if someone would say West Side, whatever you want to call it, in that area, could we use another food bank? Would that be something you'd say, yeah, that's a good idea if we had the right place and so on? Or might you say, well, there's other more important things to do? I don't know the answer to that question.
I don't want to misspeak and speak off the top of my head on that, but I'd have to look at. I would say if someone wanted to start a food bank, we should start with talking and looking at what food pantries are around there already, what their experience is. Are there certain populations?
And you'd be a good person to talk to.
Yeah,
Okay.
I'd be
I'm going to
happy
remember
to
that
help
because
you.
I'm the person who's going to talk to you.
Yeah, absolutely, and
Okay.
I would connect with Worcester County Food Bank as well.
Okay, and you mentioned the two markets, obviously, has, hurt people, the two markets that closed, big markets in Worcester.
Yep.
Does the city at all try to find replacements? Do we talk to, as a city, talk to these?
I know the city manager had reached out with the management ownership of Stop and Shop at the time when it closed. And then the Economic Development Department has been working closely with us and helping to look at, loan programs, potential grant programs that might be available. We've been exploring, are there tax incentives? Are there other supportive services that could help to recruit? There was an article in GBH recently of Sam Turkin wrote comparing Shrewsbury and Worcester, and he was really making the case that I don't want to I know this is getting into city council world, but that I don't want to miss because I told him at the time I don't really know enough to comment on it. But he was really making the case that it was Shrewsbury's tax code that was able to recruit such a concentration of grocery stores when Worcester wasn't. I don't know if that is the whole case, but they do have, they've got Shaw's, Market Basket, Trader Joe's, Whole Foods, pretty close together.
They do,
Yeah.
right,
Yeah.
they do. Always thought that restaurants and places like Panera's, bakeries and so on, they have a lot of food left over at the end of the day, but I know they're worried about, insurance and so on, liability. But boy, it seems like they must throw out a lot of food, restaurants and so on, that could be used by people. Is that something we work on too, to try to get those?
Absolutely, yeah. Food recovery is a really important part of the food system. I mean, Spoonfills is a Boston-based organization that has a presence in Worcester that does some food recovery. Also, Rachel's Table has a long history in Worcester doing some of that work too and getting it to, the food pantries and distribution sites. But I think that could really grow in Worcester.
And my last question, I don't believe, well, of course, you didn't go through every page, so maybe it's in here, but I don't believe that I have a little comment here that I didn't hear in your report, which is amazing because your report was great. Hydroponics.
Yeah, we did not look at hydroponics.
Okay, the
Yeah.
reason I say that, because I'm the one who's thinking on the west side of Worcester, I think I've got a good location that might be a great food pantry. Talked to a few others, they said it's not bad. And talking to Charles Lust, who's into hydroponics, it would be unique because we would have hydroponics going on at the same time as a food pantry. And I think it's a terrific location, but we'll talk about that. But hydroponics, is that important to food insecurity or not?
I think it could be. I think if it grows enough food, yeah. I mean, I think sometimes there's limitations in kind of upkeep and follow through with like how much food is being produced by hydroponics. I think it depends on the grower and how that's managed, but I think there's been a lot of sites that they haven't. I think also, sometimes my question is to folks, like, is it that we can't get lettuce? Is that the main issue? Like, do we have a shortage here? I think sometimes it's also a great teaching tool and interest. So it's like kind of, I think we just have to be accountable to like what the need is. If it's a tool for education, if it's an opportunity to get youth involved and do things, like hydroponics, I think can provide those things. If you just want like the straightest line to some food, sometimes you can just purchase it for lower cost.
Right, okay. Thank you very much. Me?
Thank you, Mr. Chair. I also had hydroponics on my list as well. But I know that, the REC grows a ton of food as well. And one of the things that I've always been advocating for is educating people about self-sufficiency. Years ago, people used to have gardens in their backyards. And if you don't have a backyard, if you're living in an inner city, maybe you've got a windowsill that you could at least grow a few things from, but
Yep.
people aren't thinking about that. There are ways, when I was teaching, I taught some of my students I was at Wooded Day 3, how to build a vertical garden using soda bottles and string and, so that you were able to, even without any yard, you could do some of that, So I think it's really important that maybe we talk about that. What are some of the resources that we can give people? You can build a garden with this, you can do this, so.
Do we still have those neighborhood gardens?
Oh, yeah, absolutely.
yeah,
I was director of program
Yeah.
for RC for 12 years, and so I think, it's
Yeah.
left still about, I think the majority of Worcester Public Schools have school gardens,
do.
plus, like, there's at least still another 25 community gardens, still very active across the city. I think the question just becomes often, because if you look at this, it's like, if people don't have the time,
Right.
I know there are some like low barrier, easy ways to grow. I grow in my house, I have a small garden. I don't feed myself primarily from that garden, I will say, despite my best effort. I'm very proud when I'm able to put a tomato that I grew on the table, but it's not my main source of food. And so sometimes I just want to caution us in thinking about particularly making recommendations to low-income communities if they, have the time or desire to do that, when it's like sometimes there's more, like I said,
Right.
early straight lines to
Well,
food.
that's all, that's through you, Mr. Chair, that's all part of the whole thing, but giving people
Yeah.
options and saying, this is what you can do, this is a unique way to do it. The other thing I have to disclose that my day job, I do work for the Worcester County Sheriff, and I just want to also mention that he is, through their organic farm, giving out over 250,000 pounds of fresh vegetables and fruit every year.
Yeah, that's great.
Yep. Yeah, so, I mean, there's lots of things that they can do. It's through Worcester County, but a lot of the El Buen San Martino, a lot of the local organizations here benefit from it. The Lorraine Laurie Center down there. Yeah. So, but I just want to say thank you very much. And again, working on a comprehensive, up-to-date pantry list, very important.
Yep, absolutely.
Thank you.
Thank you, Council Toomey. Council King?
Thank you, Mr. Chairman. First, thank you. We appreciate the work that you do. We appreciate, making sure that you're addressing systemic challenges while advocating on the state level, as well as clearly working with community partners and, of course, the council and the administration, the city at large. So thank you for that, and we appreciate Department of Public Health and their support as well. That being said, I had an initial question. As I mentioned earlier when we were speaking, and I kind of alluded to the importance of data, and that data should be a driver. Can you speak a little bit to the small sample size of the survey that went out pertaining to, I think it was DTA, what have I think it was 12 or 20 something respondents.
For
I'll find the page number.
And part of this
Yeah.
survey? Yeah, I mean, it's in no way comprehensive. I think what we were excited about with this data is that through utilizing community researchers, community leaders as community researchers, we were able to actually get a much more representative sample size of folks who participated than we
Yeah, I think it was
typically
14,
have.
page 61.
Okay.
Yeah.
Whereas, in this page, when we have whose voices are we hearing, I think typically when we've looked at the number of participants we've had across some research that we've done, we've had, many more white women participate than are representative of the communities at need, I'll just say, frankly. However, in this data, I think we were actually able to get a much close, of the respondents to the survey, 48% said their household income was less than $25,000 a year. 59% of community conversations fell into that. Whereas we felt like we were able to get more in-depth sampling, understanding of how people were expressing their needs than we have in other data sets. Is that representative of a city of 200,000 plus? No, absolutely not. And so I think there's lots more we could do to dive in.
Yeah, and I apologize. That was pertaining to the accessing the food pantries.
Okay.
That's where that data was from, the 14 respondents.
It might have been of
Piece
the-
about the gift cards, that was one of the respondent recommendations. Can you speak to that? I know that there's some gift carding that was going on from a while ago with some funding that came in. Is there anything in play currently specific to provision at the food pantries, and is there a funding source
There's some.
outside of what we already have?
Yeah, I mean, absolutely. I think it was from this data and from some of these lessons that we were able to make the recommendation when the SNAP crisis happened about how to respond and just say, let's just give people money through gift cards, sometimes through Visa, sometimes through grocery gift cards, because, like what we heard, like, again, in those causal loop diagrams is like people want to be healthy. They want to provide for their families, but sometimes they're just resource strapped. And if they're and sometimes they have to spend that, they say rent eats first, and sometimes they have to spend that money they have on rent, and then they don't have the money for groceries. And so they're shortchanging themselves nutritionally. And so based on this understanding, when the SNAP crisis came and United Way was raising funds, we're able, from the Center of Food Equity, to say, let's just buy gift cards and get people money in like very straightforward ways. And so right now, the Worcester County Food Bank does still purchase. They're purchasing food on top of what they get for allotments through MEFAB, which is the Massachusetts program that distributes the food through food banks to food pantries. But they also they're purchasing food and buying it and providing it beyond that. Plus, they're buying gift cards that they provide to food pantries so they can give those out to folks. And then we didn't want to drive more people to food pantries. Plus, we knew that not everyone that needs food goes to a food pantry. And so we decided to give the gift cards out through Worcester Housing Authority, particularly for senior and disabled community members, through Worcester Community Action Council, through fuel assistance, and through Worcester Public Schools through the wraparound coordinators, so they could help us identify the most high-need families in each school. So we are still distributing those.
Thank you. Good and great work. Just wondering, as we sit here, for folks that are entering into the workforce, folks, perhaps stalled in the midst of their pursuit for higher education or of building trades or a separate vocation, is there any sort of targeting of those groups? So I'm wondering if in the domains and the spaces that we're referencing, to what degree are we able to target them in terms of educating them on all the things that are going on that they may avail themselves of? I know that the mutual aid page on Facebook hits some of those demographics, but I'm just wondering outside of that if there's any specific recommendations through the chair.
Yeah, that's a good question. I mean, we are doing trainings with the new work requirements. Able-bodied people without dependents used to be able to be exempt from work requirements if you had a dependent. However, now people are being required to have work commitments in order to maintain their SNAP benefits. So we've been trying through that to think about how do we connect with workforce agencies, volunteer agencies, to kind of communicate where there's opportunities to kind of get involved in these systems through there. I can offer that. We do lots of presentations at colleges. We do advocacy trainings, kind of talking through this and presenting on the findings here. I think there could be more concerted effort because I think there is a lot of misunderstanding on why people are food insecure and like how resources are cobbled together. And so I think a better, kind of more comprehensive understanding could also drive people into opportunities to give back through workforce opportunities.
Thank you. I really appreciate in this report, speaking to the social determinants of health, you've talked about some of the systemic changes as it relates to transportation, stigma, diversity of food pantries or the lack thereof, and more. So I certainly appreciate that. We know that in order for folks to lift themselves out of their life circumstances or to maintain, to survive or to flourish, their basic needs have to be met. As you mentioned, food, shelter, clothing, and access to many things. So that aspect of this is certainly appreciated. It runs throughout this report. I encourage anyone who can. I don't know if we're able to get this up on the website, Mr.
Yeah, it's
Chairman.
at centerfoodequity.com. There's a page that has it.
Yeah, perhaps there's a link on our city website that can send people there if you're so inclined, Mr. Chairman.
Want to make that as a chairman's order?
Sure.
So we have a link on the city's website to which is it this one that we're talking about, or the Worcester Community Food Assessment? Is that the one you mean, or today's?
Whichever one.
There's a couple
Yeah,
of them
there's
here.
foodhelpworcester.org too, that is has the community resources, and then this is kind of like the research
Maybe
behind
community
it, so-
resources and a summation of the report.
Because this is good information for the
Yes.
public. They like to read it, so that'll be a motion from the chair. All in favor? Opposed, so voted.
Thank you, Mr. Chairman. As mentioned, again, data. How do we measure service provision? And that's really important. And I hope that if there's a college or university you're working with, they can dig down into some of that, to expand your capacities with your group. That being said, lived experience. I was particularly pleased to see that there as well, that there's a intention in the recommendations for their active contributions in order to implement recommendations. And it mentioned paid compensation for their time. And I'm
Yep.
just wondering what funding source, has there been any discussion with the city regarding earmarks? In addition to, if you could share any conversations with the administration. We do have a Municipal Operations and Legislative Affairs Committee where that might be appropriate, or it could be appropriate here for that state discussion for the folks that don't believe that state and city intersect. But that being said, what are the funding mechanisms for something like that? Are you looking at grants, looking at the Worcester Community, whatever foundation, or are we looking at sort of a steady stream that's somehow written into legislation or budget for the city of Worcester? As I mentioned, we are a hub. We're not Boston, but we're a hub of services, and we're a hub of opportunities for people. So I was wondering if you could share a little bit about that compensation piece, please. Through the
Yeah,
chair.
absolutely. So, and I did not come here to make a pitch, but but now that you're opening the door, no, but the Center on Food Equity and all of the work we've done right now has been funded primarily through the Worcester County Food Bank. The Greater Worcester Community Foundation, it's helped to support the food assessment itself, but otherwise been through the food assessment. Gina and I both have full-time jobs. I'm the executive director of the Coalition for Health through Greater Worcester. So this is just a, on the side volunteer position to help to coordinate this work, as well as, Gina's work locally as well. But we are able to get some funding for stipends we're offering for folks for the trainings that we've been able to offer, some of the print materials for the community researchers who did the work. We've supported people to participate in hearings through stipends and other things. That has all been funded by Worcester County Food Bank to date. With Jean McMurray retiring, we only have commitment from the Worcester County Food Bank through June currently for the Center on Food Equity. They haven't named the new CEO yet, so we're in a little bit of a vulnerable position, I think. I'm hopeful that we can continue that relationship, but it might make sense for us to look at, kind of diversifying our funds in support of the Center of Food Equity and the work we do, because I do think it's really important that we continue this work. We've been really successful. We have a lot of ongoing initiatives. So I would be, really open. There's other models or a lot other cities, Boston, you look at their Boston Food Action Network, I think it's called, and they've got like 12 staff in this food, I know it's a different world, but I'm like, always looking kind of are very jealous of the infrastructure they have around doing food work. There's other models where there's, staff positions where you could work in partnership on it as well. So I think there's opportunity. UMass Memorial has also named food security as one of their new priority areas. So maybe there's opportunity to open up doors there too.
Thank you. I have a follow-up, but I'm going to leave it alone for now. I appreciate that. It was very helpful. I noticed that in the second recommendation here, it indicates on page 67, if anyone ends up reviewing this from the public, it indicates, again, it's talking about data as a means to implement, monitor, and evaluate strategies, which, again, is extremely important. I hope that we take a look at that with our cooling and heating opportunities for people. You have to do that in order to provide the best service provision possible, particularly when it's an intersection between government and the private sector. That being said, it indicated here, as you already mentioned, folks more likely to face food insecurity, but it looks at and it calls it inadequate data for the following populations: Black and Indigenous communities, LGBTQIA communities, immigrants, refugees, and other arrivals. And it notes that while foundational data is suggests that these are priority populations, we didn't have the data. So I'm wondering two things. One, what was the barrier there? Is it a capacity thing? Is it stigma? Is it something else? And then two, is there evidence-based research that could be part of this specific to those communities, through the chair?
Yeah, absolutely. So I think it is a capacity issue around, limitations in collecting data. There's also stigma of reaching populations. I think we did a good job of hiring researchers who are representative of those communities, had trust and connections to be able to do it, but still barriers to participation. I think the other thing that's really challenging is, USDA just changed that they're not collecting food security data anymore with a lot of the indicators that we've really relied on. And so I think there's some consideration that could be made for state legislation that could ask to maintain collecting some of this data, because it's really critically important to drive our investments.
Thank you. That was very helpful as well. I appreciate that. You talked a little bit about the, I can't remember the term, but I wrote it down somewhere, but the state legislation that you guys were supporting. Can you give like 3 sentences as to what that is? Because I think it might be helpful for us as a committee to get it in here and discuss it, maybe get, if there's anyone from the delegation that signed on to that, if the chair feels that's appropriate, or if the council feels it's appropriate, or the mayor to send here. Just wondering if you could speak a little bit to that legislation.
Sure, yeah. So the Act to Protect the Safety Net, it's co-sponsored by Senator Moore and Representative Keefe, and it requires DTA statewide to engage the community engage process before closing or relocating an office. Worcester is not the only office that moved. We saw the Salem office right before the pandemic close Plymouth office closed completely, and as well as other offices around the state as they make cost-cutting decisions and different things. However, with the call volume, all of these things, this really impacts access. So it was voted favorably out of the Joint Committee for Children, Families, and People with Disabilities, I think it's called. And so, we need to just raise this on people's awareness list. It's not tied budgetarily, so hopefully, we think that is, more promising than some other pieces. But, I know they deal with 8,000 pieces of legislation a session, so we're trying to raise the profile.
Thank you. Going back to some of the conditions that impact folks accessing services, for lack of everything we're talking about here. We know that there are folks living in the shadows in the city of Worcester. One of the low points was Eureka Street and what happened over there. And I know firsthand as a social worker that folks are in shadows, not accessing medical help, hesitant to access pantries. As you mentioned, engaging with government. We know that the Haitian community right now, I don't know if it's today, but they're withdrawing and they're losing their TPS, and for the public, that's temporary protected status as a refugee community, which will have a big impact on public health service provision, given the numbers of folks from that community that are engaged in nursing and home health care and et cetera. So my question as it pertains to that is, when we're looking at immigrant groups accessing these supports, I know that there's a chill. We've seen the murders that occurred as it relates to ICE and the 2 individuals that were taken away. And that has an impact right here in the city. So I'm just wondering, has that been on the radar of this coalition, the steering committee, the staff, et cetera? And what is the strategic plan for that? And can the city of Worcester be helpful in any degree? Can this committee be helpful? Can the Board of Public Health be helpful? Like, how can we engage together to make sure that people are safe and that they understand that, I work at the Department of Children and Families, it's no mistake. When we collect data, we're asking information about immigration status. And people are uncomfortable to even ask it, much less give that information. Where does it go? So what can you say as relates to all of that? And is there a way for us to engage together through the chair?
Yeah, absolutely. I think we are seeing damage on damage on damage with what's happening with the intentional scare tactics around the violent immigration enforcement, around the violence that we've seen, and that's having direct effects here. We've heard from many of our food pantry partners that they've seen drop-offs and people coming for resources, that we've seen we've seen in the past, and we expect to see a whole nother round again of drop-off and SNAP application and WIC and things made for young children and families getting critical resources that they need because people are fearful. And I think at times in this climate, we need to be cautious of, a lot of times when some people know this misinformation, this is public charge, you are protected here. And I'm not sure if I can say that in confidence anymore. And so I am looking to alternative systems to help to support people wherever we can, if that can be gift cards and cash and resources to get from, one day to the next, if that can be food pantry deliveries that can be done anonymously as possible. We just spoke to, Jillian Phillips at the Office of New Americans about some of the distribution she's doing and how we can partner with some of the Worcester County Food Bank gift cards to get resources to people without names attached. And I think really being understanding of those bureaucratic burdens, how they're not just burdens in time and capacity, but also can also have a chill effect in people participating in those resources. I think we have to be kind of humane and cognizant of when we're designing those programs to know if we're really going to try to be accountable to reach the people who need the most.
Okay, thank you. I think that's so important as we move forward on any issue related to public health, public safety, public well-being, is that it takes all of us together because there's kids, there's families, there's elders, there's individuals who are in need. So any barrier to that, in addition to what's already in play systemically, socially, et cetera, we should do all we can to kind of navigate through that. The last thing, I have two things actually. One is student food insecurity. So I work with young people from 0 up to age 22, 23 years of age. I have two that I work with in colleges across the Commonwealth. And as mentioned, I think Councilor Rosen mentioned, I believe, something, or perhaps Councilor Toomey, about our schools, our kids in college, young people, kids, young adults in college. And I know from firsthand experience, currently navigating this now, zero understanding or knowledge of, SNAP benefits, fuel assistance, et cetera. And, often is the case, these young adults have no one outside of their social worker, and they might have a certain feeling about coming up in a system that's not what it could be, and don't want to ask for help. So is there anything that you're aware of, any sort of public service push for that population? That stigma is real. I try to let them know, hey, this is your money, your auntie, your uncle, your cousin, your girlfriend, their parents, whoever you are in familiarity with, they've paid into this system. It's your money.
Yeah.
What are you going to do with it? So I'm just wondering, I heard about the hunger-free campuses. There's only 2.
Well,
there's the
public
just the public universities.
Yeah.
Perhaps our private universities should get on the dole, I guess, for lack of a better term. Perhaps the chairman will do something with that in the future. But what can be done strategically for targeting those groups, and not just in college, the young folks that are coming out, and trying to get through life, and perhaps are surfing or couch surfing, or trying to make ends meet in this housing economy through the chair.
Yeah, I think there's ways to help to be direct and supportive through the consortium of colleges as well, and thinking about kind of best practices and support. We've had a lot of conversations with our private universities about investing in resources for their student bodies, investing for their international students, thinking about really connecting. I think all of the colleges have food pantries on campus. However, we know that's not enough. It's not everything that they need. And oftentimes people need to be connected to other resources as well. And so I think really, I cannot say enough, not only on universities, but like I said, throughout all these things, the amount of time that it just takes anyone to navigate from one thing to the next is overwhelming when people are already stretched for time and stressed and all of these things. And so investing in community health workers and case managers and counselors and support that can be in those locations, in those opportunities for touch points with people to help to actually support them through. This is what you're eligible for. Now we're enrolling together. Now we can connect you to some food for tonight. And now we can, and here's how we're going to connect to in the future. And then here's, upward mobility programs too that you can also participate in, I think is really where we're needed. I look a lot to the Resiliency Center at Worcester Community Action Council has really invested that as part of their model. Maide Morales is the director there at the Resiliency Center. And I think it's really built around that model of connectivity, because that shows up not just in food, but in almost all of the social service programs, that we work with and see. It's just like that navigation coordination that is really challenging. And so I think coordination across the consortium and like really investing in how you connecting kind of the holistic well-being of your student body. And I know it's a tough financial year for universities, but is there ways they can leverage and really prioritize that?
Thank you, Mr. Chairman. The last one is this. You'd mentioned, someone on the panel here in the committee talked about the closed grocery stores. I have a order that's waiting to be heard back regarding a factual definition of what is a food desert. If in fact there's a demographic or location in the city that meets that criteria, so that we can move forward. Do you have any information on that? Where is it? And this is informal. I mean, it's
Yeah.
not, well, it's formally, it's a discussion, right? Because I'm waiting for the report back,
Yeah.
because we could say one thing, and if there is a food desert, I'm assuming that there's grants. I don't know if there's any federal resources anymore right now with that clown out there, but I'm just wondering, what is the definition? Is there an area? Where is it? Please, through the chair.
So I think it's shifted a bit. There are maps through USDA and other places, Mass Food Systems Collaborative, that you can look at mappable, and zero down to your city of where food deserts are. Traditionally, they've been defined as, low private transportation, low grocery store access within either half a mile or 1 mile from where you are. And you look at like epicenters. Traditionally, and I'm going to misspeak a little bit, what I've seen is that really Great Brook Valley and Bell Hill are the two areas that fall under that. And so that's only been worsened by closing of Stop and Shop. However, the argument I often make as well is that we see food insecurity in Maine South that has a lot of grocery stores. We have a Price Right, we have cultural grocery stores, we have Mekong, we have Gala, we have Hatien, we have a number of grocery stores in that neighborhood. And I think we have to look at the complexity of what's driving. This is poverty-induced food insecurity. And so where you see concentrations of poverty is where you're going to see, concentrations of food insecurity as well. And that's, compounded by a number of different factors. And again, time, basic resources, access to federal benefits, grocery store access is an important component of that, but I don't think that is everything in looking at food security. However, I think there are potential incentives and cases you could make for grocery store locations that could look at, particularly around those areas. Bell Hill, I think, is geographically maybe a little tougher up and down Belmont Street, but however, maybe Lower Lincoln over there could, get a resource. That's my Worcester
Thank you,
geography.
Mr. Chairman.
Thank you, Councilor King. Councilor Toomey.
I'll be very brief. One last plug, actually. The Route 12 for the RTA to Market Basket does not run on the weekends. I'm absolutely blown out of my mind. Why wouldn't have access to a supermarket? I understand the DTA and the RMV are all closed, but there are people coming, not just from Worcester, but from Worcester County, right, who are coming and using our transportation to try to get there. And you want to talk about access. If you're not letting people may be working during the week, right? If they don't have time to be able to go buy food. So if there's a plug that you can push for that, at least one day on the weekend, a couple of routes, a couple of bus
And that's our Public Service and Transportation Committee. We've got to let them know.
No, but I'm just asking
Sure.
for her advocacy.
Yeah, CMRPC was convening a transportation food access group where they were meeting with RTA. There's a pause in that group just because someone's role has shifted. But I think I would love to re-engage there because it is such a central part of their work to really engage in direct advocacy and partnership with RTA on some of these things. So I don't have a direct line right now, but let's work on that.
Well, thank you, appreciate it. Thank you, Mr. Chair.
Thank you, Councilor Toomey, and Casey, thank you very much for an excellent presentation.
Yeah, no, thank you.
Very
Thank you for
informative,
having
very
me.
interesting, and a lot of food for thought for this committee and the Worcester City Council. On 4D, transmitting informational communication relative to a Worcester Community Food Assessment Report from August 27th, 2024. The motion would be to file. All in favor?
Aye.
Opposed? So voted. And on Council Toomey's motion to adjourn, all in favor? Aye. Opposed? So voted. Thank you very much.